All of the questions were really good, so let's start with Jan, who asks, can you have the flu without a fever? The answer is that while it is much more common to have a fever with the flu, it is possible to have the flu without a fever. And I have two specific notes about that. First, it could simply be that the person isn't mounting a fever. That's more likely to occur in people with immune compromise or even older people. My second thought is there are many people who might be on medications like NSAIDs or even Tylenol for other conditions like arthritis or pain, and the medications they're on might be suppressing a fever. Andrea asks, we got our flu shots in September 2025. Should we get a second shot now? The answer is no. One flu shot per season is generally enough because the goal is to boost your immunity to the strains most likely to be circulating, and the vaccine is only reformulated once a year. Now, there are two exceptions. First is any child who's getting a flu vaccine for the first time. They need 2 doses 4 weeks apart. The second might be any immune compromise where your doctor might recommend a second vaccination. Jackie asks, what should I do if I get it when recovering from open heart surgery? So this is obviously pretty specific, but I have some important, more general thoughts. First off, anyone that's recently undergone major surgery is at risk for a more severe case of the flu or its complications, and this is even more so with any heart or lung procedure. If you develop the flu, you should not be shy about calling either your surgeon or your primary care doctor as soon as possible. Antiviral medications like Tamiflu might be especially helpful for situations like that. Now, specific to open heart surgery, I would point out that a cough can be especially problematic as your breastbone is still healing and your general risk of complications is going to be much higher, so you should definitely contact your surgeon. Julie asks, what are the first signs you have the flu? Now, obviously, it's going to be a little bit different for everyone, but one thing that more commonly happens with the flu that points to it as the source is a very sudden onset. People often describe it as feeling like they got hit by a truck with body aches, fever, chills, weakness, headache, and respiratory symptoms basically coming on over just a few hours. Sven asks, why do people run to the ER for flu treatment? Now, personally, as an ER doc, I'd rather see people come too soon than too late. But medically speaking, the most common reasons are high fever with dehydration that need IV fluids, as well as increasing shortness of breath where pneumonia might be a concern. Also, unfortunately, it can be just because they have a concern, but they can't get in to see their own doctor, which is generally preferred. Now, finally, I would point out, there are times when antiviral medications can be especially helpful, but they need to be started within 48 hours, which might mean a trip to the ER or urgent care. Jessica asks, why has my child gotten influenza A twice just 3 weeks apart? So Jessica, that can happen, and there's a couple of likely explanations. It is possible to get infected with 2 different influenza A strains. This year it would be H1N1 and H3N2. Now, it is also possible that it was a resurgence of an infection after an initial improvement. Katie asks, when I get the flu shot, I get sick for well over a month, so now I don't get it. Any explanation? All right, so here's the thing. While a flu shot can definitely make some people feel crummy for a day or two, a month is not expected at all, and I don't really have a specific explanation for your situation. The only thing I will say is it is not because the flu shot gave you the flu. A month-long illness after a vaccine might actually be from a different problem, and you should discuss that with your doctor. Patty asks, how long does this strain take to run its course? So it's different for everyone. Now, while this year's more common flu strain does appear to spread more easily and cause more severe symptoms, the duration isn't any different. Starting from when you're exposed, it takes about 2 days to begin to get sick. Then symptoms often rapidly worsen over the next few days and often begin to improve after about 5 to 7 days. Now, it is possible for a cough to linger for another week or two, but it should be improving overall. If it's not improving or your fevers are persistent or recur, that is a clear reason to get evaluated for a complication like a bacterial pneumonia. Back to you.